adults are increasingly dying from unintentional falls. That's according to a new report published by the U.S. Centers for Disease Control and Prevention. From 2003 to 2023, death rates from falls rose more than 70% for adults ages 65 to 74. The report also says the rate increased more than 75% for people aged 75 to 84. CDC researchers didn't try to answer why death rates from falls are increasing, but experts say there may be a few reasons, such as more people living longer to ages when falls are more likely to have deadly consequences. Falls can cause head injuries or broken bones, which can lead to permanent disability and trigger a cascade of other health problems. Experts say staying active can help people avoid falls. The U.S. Food and Drug Administration has approved a new HIV prevention shot. Drug maker Gilead Sciences announced lenacapavir, a twice-a-year injection to treat HIV, can now be used to prevent infections from happening. In clinical trials, the drug reduced the risk of HIV infection by 96%. It will be distributed under the brand name Yeztugo. The company adds, based on insurance coverage in the U.S., it could take up to 2 months for someone to get their first injections. It's estimated to affect more than 100 million adults in North America, but many have no idea they have it. It's called fatty liver disease, and the American Liver Foundation says if left untreated, one type of the disease can lead to some serious, even fatal health conditions. CNN's Mandy Gaither explains.
In 2001, at the age of 45, Pam Miller went in for gastric bypass surgery.
I was finally going to get rid of all the weight that I had because I weighed nearly 300 pounds then.
But she says that surgery was aborted. There was a major problem with her liver, and she had no idea.
I really had no symptoms. Even my blood work was normal.
Back then, Miller says she didn't know anything about non-alcoholic fatty liver disease. It's caused by a buildup of fat in the liver that interferes with the organ's functioning, and that's what she was diagnosed with. On top of that, her doctor told her it was stage 4.
He told me I had approximately 6 years to live, that there was no cure, and, basically, good luck.
Miller decided to get a second opinion at the Ohio State University Wexner Medical Center and learned about how lifestyle changes can help. For her, that meant weight loss.
It's so important to really increase awareness for this condition and for patients to ask their doctors whether or not they need to be screened for it.
Dr. Vivek Mendarada says sometimes blood work can detect a problem, but there's also a screening called FibroScan that quickly examines the liver.
It's essentially just an ultrasound that takes about 10 or 15 minutes. There's no poking, no needles.
It's now been 24 years since her diagnosis, and Miller is still maintaining healthy habits.
I think this is God's will, that I'm supposed to get out and teach others that you need to listen to your body.
For Health Minute, I'm Mandy Gaither.
Medical Watch is brought to you by Manukin Koster Denture Clinic.